Hello, everyone. Welcome to Ewube Brown on Thursday. Another very educative segment where we talk about medical issues that is affecting our people. And today I have a guest speaker that is none other than Dr. Julius Ngu. He's a board certified medical doctor in the United States. So he's going to be talking about some of the stuff that we face, like hypertension, diabetes, cancer, weight issues, sexual issues, and everything. So if you're watching, please like and share these videos, invite your friends, your families, your mothers, your sisters, your uncles. They will want to be here so they can get it from a professional firsthand. So I'm gonna let my guest introduce himself. Over to you, Dr. Julius.
All right. Thank you, Miss Ewube. Thanks for inviting me. It's always an honor to serve people and equally to give back by word of advice. So my name is Dr. Julius Ngu. I did train in Cameroon. That's where I did my medical school in the University of Yaoundé 1. Thereafter, I worked in Limbe for a year as a general practitioner in the provincial hospital. I equally did work in a general hospital in Douala. I would say that before heading on to Limbe. Thereafter, I did a short stint in the UK. I did public health and epidemiology. Then I moved over to the United States. I started off with a doctoral program in public health. Went on to general surgery. I did 3 years of general surgery, but today I work as a primary care physician. All right, I do general medicine, I did primary care, and some days or some weekends I do emergency medicine. So I wear different hats depending on the situation. And I think my wealth of experience has permitted me to be able to, you know, put me in a position where I can give advice on a multiple range of health issues affecting our population, both in the United States and in Cameroon.
Thank you so much, Dr. Julius, for accepting my invitation to come over here. I really appreciate you. I feel like this illnesses, these medical things that we're going to be talking about today, it is what a lot of us. I, for one, I have hypertension, so I take two different blood pressure medications, but mine is genetic. So I can't, you explain it better to our people. But before we go deep, I'm going to go ahead and share this on my Facebook page. That way they know we're live. That we're in. Then we can start. Give me a second. We're live, share. Let's see. Share. Hold on. Did I share? We are live now. So we can have. All right, people. So I shared. If you're watching, please like and share the video. We need this video to reach as many people as it can. Okay. So my first topic of discussion today will be on hypertension, blood pressure. That's what we call blood pressure in Cameroon. Over here, we use the word hypertension because we're medical professionals, but lay people they use blood pressure. So, doctor,
Mhm.
we want to know about the risk factors, how to prevent it, how to manage it, and some of the symptoms.
Okay. So high blood pressure is a condition in which the pressure with which blood flows through our blood vessels is abnormally high. So the heart is the main pumping mechanism that distributes blood to different body organs. It's linked to those body organs by little tubes. If you imagine them to be pipes, we call those tubes blood vessels. Generally, as you age, those blood vessels they become less pliable or they become much more stiff, to use a simple word. And therefore, if you imagine water flowing through a stiff pipe, most often that stiffness contributes to an increased pressure within the pipe. So generally, as you grow older, your blood vessels become, I would say, less elastic, and therefore the pressure with which blood flows through them is higher. That's a very simplistic way to describe what blood pressure is all about. In itself, it's a disease as much as it can be a risk factor for other diseases such as heart disease, stroke, kidney failure. Okay. It's a very common problem worldwide, particularly in developed countries where lifestyle, I would say Western lifestyle in quotes, tends to contribute significantly towards this disease condition. So, by lifestyle, I mean lack of physical activity or less than optimal physical activity, obesity, foods rich in sodium, and equally stress levels. Okay, those are key contributors. Or other, I would mention things like alcohol, use of energy drinks, use of caffeine, smoking. The nicotine in smoke tends to contribute to blood pressure. So you see that there are many things that we that forms part of our daily life that ultimately, if not checked, can lead to blood pressure. And the mere fact of aging, as we grow old or grow past the age, as we age past 40 to 50 years old, our blood pressure starts ticking up on average, because that's when our blood vessels become stiffer and they become older. Right. So in a brief nutshell, that's how I would describe pressure, high blood pressure, and the factors that will contribute to.
What about genetics? Like people like us that like we inherited it from our parents.
So, true, genetics do contribute most often, 99.99% of the cases, or I'll say at least over 95% of the cases, blood pressure, high blood pressure is multifactorial, meaning that there's more than one thing that
That
causes the
concept.
blood pressure.
Okay, okay.
Your genetics could form the basis of it, but then you have
Other
added
things.
layers of other factors that
Okay,
would then compound the problem and make it more evident or worse.
okay.
Mhm.
Thank you so much for the explanation. At least, all right.
Mhm.
We can move on to some of the symptoms
Mhm.
of
Okay.
heart. Some of the symptoms. What do we do? Some of the symptoms of heart attack and stroke, because heart attack and stroke is so common now. We have people driving and having heart attack. We have people strokes, and like your family members are looking at them and don't even know this person is having a stroke. So what are those what are those things that we can see and identify that, hey, this person is actually having a stroke, how we can help them, and what are the little things that when you see somebody having a stroke, what can you do?
Okay. So before I address that question, let me just define or state what stroke and heart attack is, right? So stroke is when you have decreased blood flow, sudden decreased blood flow to a part of the brain, and that would typically manifest as maybe loss of consciousness, weakness on one side of the body, or sudden drooping on one side of the mouth. So it can be in the form of a seizure, abnormal, uncontrolled movement of the entire body or one part of the body. Stroke can manifest at times at that. At other times, it is very subtle. The individual may just suddenly be dazed or blanks out, or the individual can fall. Okay. So there are many varied presentation of stroke. Most often it's probably a problem with the heart or blockage of the blood vessels that lead to the brain at the level of the neck most commonly, that would lead to stroke. Okay. um, so those are the manifestations and definition of what stroke is. Now, what would cause high blood pressure is one of the risk factors that would lead to stroke, but there are others that, as we'll see later on, like you can have genetic factors that lead to weakness in blood vessels in some parts of the brain. I should have mentioned there are two types of strokes. There is what we call hemorrhagic stroke, which is a blood vessels in the brain itself bursting. Embolic stroke, which is a blood clot in one part of the body that gets pushed to the brain and blocks a blood vessel in a localized area. Or it can be ischemic, okay, which is you can have a sudden decreased blood flow to the brain from partial obstruction of blood flow.
Can
So,
you explain ischemic to somebody that has no medical
okay,
idea,
so like I
please?
was saying, so ischemic means that there is sudden decrease in blood flow to an area of the brain
Okay.
that leads to either death of those blood cells in that area or sudden dysfunction. Okay, so there at times you can have what we call a mini stroke as opposed to a full blown stroke. And a mini stroke that is transient, meaning over a short period of hours to less than a day, they'll define it. You can have a sudden dysfunction of one part of the body. It can be a weakness or sudden blindness or drooping of one side of the body. But then that individual recovers from that deficit. Okay, if it's a weakness of your hand, you can completely recover it after a few weeks or even a few months. That case is called a transient ischemic attack or mini stroke. But in a full blown stroke, you typically remain with that deficit for several months to even years. You may recover some of the function back, meaning weakness on one part of your body. You may recover some of it, but never totally,
So
never
what are the
completely recover.
chances of having brain issue with stroke? Because some people have strokes and it messes up with your brain. They're never the same when they recover.
Absolutely. So the brain has different areas that have different functions. Some have to do with memory, some has to do with vision, some have to do with movement of one part of the body. So depending on what part of the brain is affected by the stroke, meaning which blood vessel is obstructed or burst, then the area of the brain that controls a specific function um, would determine whether that function is recoverable or not. So if it affects your area of speech, you may have problems expressing yourself. You may actually understand people well, but then you're not able to express yourself. It can affect the part of the brain that has to do with vision. You can have normal appearing eyes, but you'll be blind. We should call it that cortical blindness. So those are a few manifestations of stroke that can be permanent. Okay. So it's very important to stress that treating blood pressure, one of the main reasons why we do it is to prevent stroke. Okay. So it's critical because if the blood pressure, high blood pressure at times has no symptom.
That's
Yeah,
why they
no
call it a silent killer.
correct.
Yes, I
Until
wanted you
you
to.
suddenly get a stroke.
Yes,
So it's very important if you have a family history of high blood pressure
like me,
or you start having headaches that are
like me.
unexplained, then check your blood pressure, okay? A normal blood pressure for an adult is typically 120 over 80, 120 for the top number and 80 for the lower number. And I'll stress that it's important to use a blood pressure curve that fits the upper arm, not the one for the wrist.
Okay, so
The
the
one,
upper arm is better.
right,
And we have to make sure the artery matches where they put the artery, it matches this vein right here, correct? This artery right here.
correct.
Your
Just
breakout.
follow the
Yeah,
instructions
just follow the
that come
instructions
with the
with the
equipment,
package. Okay.
right? And make sure you're well seated, resting. Your hand is held at the level of
Your
typically where
heart.
your breast
Mm-hmm.
on the surface. You know what the body part that is
So you
overlying the
position yourself
heart.
like this.
Yes, it's typically the
And you
breast.
don't cross your legs.
Don't cross your leg. Make sure you're rested for 5 to 10 minutes. Try to empty your mind and really relax. Then you take the blood pressure, okay? It's better to take it typically in the morning before you start being active for the day because activity will raise your blood pressure. Activity will raise your blood pressure, and then eating, for example, raise your blood pressure. Taking coffee or smoking, those things you do them after you've measured your blood pressure. All right. Blood pressure tends to vary throughout the day. When you wake up in the morning, typically it's
Low.
at its low
Yes.
because you're well rested, you're relaxed. And then as you become active, you engage in one or two stressful activities during the day, it goes up. So during the day, the blood pressure will go up. Then towards the evening, once you're winding down, the blood pressure goes down as well. So it's good to take that into consideration and don't think that it's a fixed number. It varies from actually second to second. All right. It's very important to know that. But the key is to know what the normal blood pressure is. Like I mentioned, for adults, you want to keep it under 120 over 80, but not lower than 90 over 60, at which time you start having manifestations of low blood pressure, like dizziness or feeling weak or feeling tired. Okay.
Can you emphasize a little bit on how stress? Because I know some people they have no history of, they have no history of blood pressure. They watch their weight, they watch what they eat, they
Mm-hmm.
exercise.
Hmm.
Like they don't live sedentary lifestyle. They're busy people. But I feel like stress contribute, especially in the Western world.
Right.
Stress is one of the main contributors, you know, to blood pressure for some people. Like they have marital stress, financial stress, they have all kind of stress. The kids are stressing them, and from nowhere, bam, you go to the hospital, your blood pressure is like 200 over 140. Then they're like, oh, I don't have no history. How does that tell us a little bit about
Okay.
stress?
So, as adults in a busy society, stress is inevitable. What is key to emphasize here is that it's excess of stress that contributes to blood pressure. At least, to be honest, some level of stress is healthy because it increases our productivity, right? So it's the excess of stress that's an issue. So once you're stressed up, certain hormones and chemicals or neurotransmitters are released in the body, amongst which are cortisol and things we call adrenaline, noradrenaline. Those go and act on your blood vessels and try to increase the resistance of the blood of the blood vessels, right? And that would increase your blood pressure. So if you have a sustained level of stress in your life, averagely these levels of these hormones are on a higher level than what they should be, and therefore it predisposes you to blood pressure. Okay.
Okay.
The corollary reverse of this is resting, adequate sleep tend to bring down the level of the stress hormones in the body. It relaxes the blood pressure, the blood vessels, and brings down your blood pressure. So that's why it's key to say that um, the reverse of stress, which is exercise and adequate sleep, release the I'll call them the anti-stress hormones in the body, which are endorphins, which are released from the brain, and they tend to help you relax, help to decrease your blood pressure, and in the long run, keep you healthy. That's one reason why exercise and adequate sleep are critical and are essential components of blood pressure reduction.
Thank you so much for
Mhm,
that explanation
mhm.
because stress.
Absolutely.
Yeah, stress. Okay. So we've touched at least almost everything on hypertension. Just what are some of the preventive measures that we can use either to prevent the blood pressure
Mhm.
or to prevent it from getting to stroke and other heart conditions?
Okay, absolutely. I mean, I've touched on some of those already,
Yes, you have.
but I would say that if you have a genetic component of blood pressure and as you age, inevitably there's a 99 on over a 90% chance that you're going to develop blood pressure. So it doesn't serve you well if you're in denial of it. I would say even if you're in good health, regularly monitor your blood pressure. Okay, have a blood pressure machine at home. You can get one from Walmart, Walgreens. I'm not
Amazon
advertising
everywhere.
any of that. They're found
Mm-hmm.
all over the place.
Yeah.
Just get a good size one that fits your arm nicely, and you know, make sure that it's well charged and everything is working fine. Just monitor your blood pressure once a week. If you're healthy, you don't have blood pressure, and make sure that as you age, you don't develop it. Now, if you do develop blood pressure, the first thing is you talk to your doctor, and then they're going to look for reasons why you might have developed blood pressure, because there are other causes that are reversible, that you can treat or cure blood pressure in certain
Like
case.
obesity, correct?
Right, exactly.
Okay.
So if you're obese, your blood pressure is high, losing weight and
We'll
bringing down
reduce
your
it.
BMI will bring down your blood pressure. It may not completely cure you, but you'll bring down your blood pressure and decrease your requirements for medication. So it's always very important, if you do find out your blood pressure is consistently high, that you talk to your physician. And then so exercise is key for adults. We recommend 150 minutes a week of moderate intensity exercise. By this, I mean things like walking, swimming, running, you know, anything that will raise your heart rate and cause you to break out in a sweat. That is very important. You have to raise your heart rate and equally try to sweat. Um, If you do high intensity activity or high intensity exercise, then 75 minutes a week is sufficient. The key is to maintain a regularity. If you say, I'm going to exercise, 5 days a week, make sure you do it 5 days a week. It's very difficult at times to stick to that schedule, but incorporating some amount of exercise in your daily work routine is very critical, will help you achieve that goal. Okay, eating healthy, reducing the amount of salt you have in your diet, because salt helps you
Keeps
retain
water.
water
Hmm.
and therefore raise your blood pressure. Okay, so try to go for
Low
no
sodium
low
diet.
sodium diet, no added salt. Always read the labels. You need no more than 1,500 milligrams of sodium a day. Okay, so processed meat, sausage, bacon, all those tend to have a high component.
Canned foods.
Canned foods, yes, they tend to have a lot of salt
Sodium.
because salt is used to prolong the shelf life of some of those products. That's why it's always good to go natural, eat greens, which have none of this processed stuff. So that is important. Sleep, of course, we've mentioned that. Avoiding a lot of stress in your life, your relationships are stressful. Look for ways to sit down, talk, try to mitigate those factors that really increase your stress level. So
Thank you so
those are the things
much.
I'll mention.
Thank you so much, Dr. Julius, for that detailed
Explanation.
explanation on hypertension. You literally covered everything about hypertension. Tarita, any questions in the comment section that we need to address on hypertension? Yeah, can you check, please? If there's anything we need to address on hypertension, let's address it before we move on to our next illness. Let me go to the comment section and see if there's anything that needs to be addressed because I can't see the comment section.
How can one be diagnosed with hypertension? Is it just one reading of high blood pressure?
Okay, let me address that one. So,
Mhm.
the diagnosis of high blood pressure typically needs more than one reading. Okay, like I said, several factors can cause your blood pressure to go up. You need more than one reading, and you need to take them over several days or even weeks at a time. It also depends on what the initial reading is. If the initial reading is very high, by this I mean like 180 or more for the top number, or 120 or more for the bottom number, definitely you need to get treated as soon as possible. Um, Such high readings are not typically caused by transient stress in your life or taking a bottle of alcohol or energy drinks or coffee. So those ones mean that the blood pressure has been there for a long time and it's not been treated. So that needs to be addressed immediately. But lower numbers, you need to take at least two readings spread over time. At times, just coming to a doctor's office can cause your blood pressure to go up, in which case we typically recommend that the patient um, goes home, measures the blood pressure at home at different times when they are very rested in less stressful environment, take it, bring back those numbers to us, and then we'll be able to make a determination. So it needs more than one value measured over several days, at least a couple of weeks. I would say from moderately elevated blood pressure or low elevations, but not the very high ones.
Hope that answered your question. Thank you very much, Doctor. There's another question here that we're going to touch, then we move to another stuff. I have a question. For people diagnosed with high blood pressure, should we be targeting to reduce the blood pressure back to normal? For example, an African man with a blood pressure of 220 over 110.
Okay.
What should be the goal of treatment for that person?
All right. So the answer is it depends on a number of things, right? You typically don't want to lower a blood pressure too suddenly and by a large amount. Okay. So if it's 220 on the top number, you don't want to lower it suddenly to 100 for the top number. It may cause stroke because such high blood pressure numbers typically the body has become used to.
That's what I was
Yeah,
saying.
so it's a gradual decrease. Such numbers, you typically want to hospitalize the patient and monitor the blood pressure while you give the patient medication and lower it down to a lower number before you discharge the patient home with oral medication. So it's always a gradual process to reduce the blood pressure, in order not to cause other deleterious effects, okay, in the body. Right.
All right, doctor. Thank you so much.
Mhm.
Somebody said, did he talk about the effects of hypertension on chronic kidney disease and kidney failure?
Okay, I didn't mention that, but that's true. So high blood pressure, any organ that has blood vessels to it can be affected by high blood pressure, notably the eyes. That's why it's very important for patients with high blood pressure to have their eyes checked regularly, at least once a year, once every 2 years, to make sure it's not affecting your eyes. So one way that leads us to diagnose high blood pressure is when people start complaining of,
Your vision.
vision problems, and then you check their blood pressure is high, then you then realize that often that it's ultimately affected your eyes, and that's why they're presenting. So it can affect the eyes, it can affect the heart, it can affect
The kidneys.
kidneys. The kidney receive about 20% of the body's blood supply. So high blood pressure, blood under high pressure going to the kidneys can definitely lead to kidney problems or chronic kidney disease. But as you treat the blood pressure and lower it down progressively, the
The
kidney's
kidneys
function would
function.
improve. All right. Left untreated, high blood pressure would automatically lead to kidney failure, and the patient may end up being on dialysis. So, diabetes and high blood pressure are two key causes of chronic kidney disease and why patients would need dialysis. So, that's one reason why you need to get screened and get treated.
That's what I
So,
was going to say. So for
exactly.
people that have hypertension,
Mhm.
they have to make sure when they go do their labs, they tell because some doctors in Cameroon, sometimes you have to tell these doctors what labs to do.
All
So
right.
your advice for somebody in Cameroon is good to tell your doctors that, hey, can we do a kidney panel, right? That way they know where your levels are.
Absolutely. So at times, high blood pressure is a secondary to an existing kidney problem. Um, Other times, high blood pressure leads to a kidney problem. So
Okay.
the feedback can be, the other way around. So yes, it's very important that once you get diagnosed with blood pressure, you do a comprehensive workup or set of labs to find out where the problem is. Okay, at times it can be due to an existing kidney problem, particularly in patients younger than the age of 30 years old.
Okay.
So someone starting up early, that young, with high blood pressure, we often have to look for a possible cause other than just the blood vessels themselves or aging. And most commonly is the kidney. Okay. And if you fix the kidney problem, typically most of these patients recover permanently.
Okay.
Right.
So for somebody like me, that I was diagnosed with hypertension when I was 23. But when they look at it, when I was diagnosed, it was already chronic because
Hmm.
that's what the doctor told me. Like, and like they say, I didn't know. So my blood pressure at the time I was diagnosed with like 200 and something over what. They were like, how are you functioning? I had no idea, but I knew we have it in, like genetics. It
Hmm.
runs in my family.
Right.
So luckily my kidneys were not damaged at the time. So I've been taking, medications for like 20 years.
Wow.
So in my case, that is something I just have to live with for the rest of my life, correct?
Absolutely. Most patients who have blood pressure is a lifelong chronic disease, which is manageable. And there's no evidence to show that high blood pressure reduces your life expectancy, your lifespan. So adequately controlled, adequately managed, you should be able to live out the fullness of your number of years, all things being equal. That said, more than half of patients with high blood pressure on medication don't have their blood pressure controlled, unfortunately. But so that's why you need to work with your doctor closely and make the necessary changes to make sure that your blood pressure really comes down, or comes to as close as possible to normal. Yes. This is not to say that you have high blood pressure. Most often you would not have it controlled. The most common reason why blood pressure is not controlled is because patients are not compliant. They don't take their medications as prescribed. If you take your medications regularly as prescribed, you should be able to recover. You should be able to have their blood pressure controlled.
Thank you so much. Okay. For now, we're going to move
Mhm.
to another medical illness that is affecting our people, diabetes. Because for some reason, I don't diabetes work hand in hand, like they're brothers and sisters. Diabetes and hypertension. Either you have diabetes or you have hypertension or you have both. So let's talk about diabetes, the type of diabetes, the symptoms, complication, and prevention.
Okay. So there are two major types of diabetes, okay? Two major type of stress major. The most common one is type 2 diabetes, which, like high blood pressure, is a lifestyle problem. So it's a situation in which your blood sugar, you have an abnormally high blood sugar. There's an organ in your body called the pancreas. It releases a hormone called insulin that helps regulate or bring down your blood sugar, or helps your body use the sugar. We call them sugar, but it's generally carbohydrates that you take by meal. Okay. But once this organ, for some reason, either has a problem, it's not secreting adequate amounts of insulin, or it's secreting adequate amounts of insulin, but the body is not utilizing that insulin well, then you end up in a situation where you have high amounts of sugar circulating in your blood, and your cells are not using those to give you energy. So that's why we call diabetes. It commonly would manifest as you kind of feeling weak or peeing more usually than you should, waking up several times at night to pee. Um, you can have vision changes. Okay. Overall, you just feel unwell. Then, when you go and have a blood test done or urine test done, they just realize your blood sugar numbers are high. In that instance, you need treatment. Okay. Let me switch over now. Type 1 diabetes tends to occur in kids, people of younger ages.
So that is the insulin resistant kind.
That is the insulin requiring
Require
type. Let me
okay.
put it that way. So for type 1 diabetes, is the problem is that the pancreas has failed to secrete adequate amounts of insulin. Meanwhile, for type 2, like I mentioned, the main reason is that the body is not using the insulin that it secretes well. Okay. For type 1 diabetic patients, because they lack the insulin, okay, you have to replace the deficient
So
insulin
they're
by,
dependent on
right.
insulin.
They're required to inject themselves insulin to control their blood sugar, okay? In addition to controlling their diet, taking a diabetic diet, which is a diet low in carbohydrates, but kind of rich in proteins, fruits, and vegetables. For type 2 diabetes patients, they can take medication that would increase their tissue sensitivity to use the insulin, or they just help the medications themselves will help lower the blood pressure or blood sugar. Okay. So we tend to see that people with type 2 diabetes tend to be on the heavier side. They tend to have obesity because obesity decreases the sensitivity to insulin. That's why exercising, losing weight, and trying to keep your sugar
It's very
numbers down
important.
is important in preventing you from having diabetes long term. All right. So the there's a weight loss drug which is injectable, semaglutide, Wegovy, Ozempic. It was found to it was originally designed to
For
be a
diabetes.
medication for type 2 diabetes, but it was found that it helped with weight loss.
So is this something you will recommend? Like people suffering from diabetes, they suffer from obesity and they've been trying to lose weight, they can't lose weight. From your medical, as
Mhm,
a medical professional,
mhm,
is semaglutide, those injections like the
mhm,
Wegovy, the Ozempic, and now we have Monjaro that has been actually approved
mhm.
by the FDA to treat obesity. Is that something you would recommend for one of your patients to take?
So the answer is both yes and no. It depends on the patient. That's what I would say.
Okay.
Okay. If the patient is obese and has type 2 diabetes, that is a good consideration for
Okay.
the patient, because you'll be using one stone to
To
shoot two
shoot
birds.
bits.
All right. You'll be correcting the obesity and correcting the diabetes. But it's worth noting that using this peptides for weight loss should be seen as a tool to get an obese patient to where they want to go. So I'm talking in this case just for when it's used for weight loss. It's a very effective tool. You help you lose a substantial amount of your weight within a short period of time, but you need to change those habits that that cause you to gain weight in the first
First place.
instance, right? Because if you don't, once you stop taking these medications, you're likely gonna gain
The weight back.
back, right? And that'll be even very frustrating. So it's very important that as you're taking the weight loss medication, you adopt lifestyle changes, or you talk to a nutritionist, talk to an exercise, work with a um, work with a personal trainer, or really come up with exercises that, or work with your doctor to come up with exercise regimen that would help you maintain the weight loss long term. So see it as a tool to get you where you want to go, but don't see it as a tool for long term control of obesity.
Okay. Thank you so much. So, what are some? Did we summarize everything on diabetes? I think so,
All
right?
right. So diabetes, let me put it this way. There's a concept called pre-diabetes, okay? Which is, in a way, it's a good concept because it gives you room to act well ahead of time.
Mm-hmm.
So it's when your blood sugar numbers are high, that's above normal, but they are not too high for you to require medication. But this is a harbinger of something more ominous coming, and gives you that time to prepare yourself. And if you take adequate measures, you can actually stave the development of diabetes and actually reverse the development of it. So it's one of those things that, one of those diseases that, you know, it gives you an announcing sign and gives you room to act. Okay, so it's most often diagnosed with a blood test called hemoglobin A1C, which you can obtain as part of your annual visits from your doctor, or you can just do it by yourself. Walmart does offer screening for that, you know, A1C and lipid panel.
Okay.
You can get your A1C. If your A1C is high, the same measures that you use to reduce your blood sugar and your blood pressure are the same measures you use to reduce or attack your pre-diabetes. Okay, so low carb diet, exercise, and a healthy Mediterranean diet, which is just one rich in fruits and
What about
vegetables.
African food? Our
Well,
African food is high in carbohydrates.
right.
Everything we eat, the fufu, the rice, everything we eat is carbs.
That's very true. So
So it's difficult to manage
that's
the carbohydrate
okay.
intake.
This is what I commonly tell my patients who have the same background like me.
Mm-hmm.
You can take a person out of, you know, their home country. You can take their culture out of them, and food is part of our culture. Okay,
Mm-hmm.
so it's very important to know what food classes are within the foods we commonly eat. So I would normally say if a food is white in color, is starchy, is rich in carbohydrates, you should probably reduce the consumption of that significantly. If a food has color, vegetables, fruits, and salads, it's probably healthy to eat those
So you
ones.
increase those
You
ones.
increase the intake. So to keep it simple, if it's color, you got to eat more. If it's white,
You got to eat
you
less.
reduce less, right? And but things like fish, chicken, you know, beans, those are proteins.
You eat
Yes,
more.
you can eat some of those, but not as much as you would eat the fruits and vegetables. Coming to fruits is very critical to make sure that you don't consume a lot of fruits that are rich in sugar. If you put a fruit in your mouth, is sweet or too sweet, it's probably not a good idea to
Because
eat
that
a.
sugar is going to tend
Correct.
to carbs, or
Yes.
carbs tends to sugar.
Imagine
whatever.
when you blend watermelon, right, and
Yeah.
put it in a glass. That is virtually like soda you're drinking. All right. So watermelon is a healthy fruit. It has a lot of fibers, but you probably want to eat smaller quantities of it. So watermelon, oranges, pineapples,
What about grapes? Those
and
sweet
grapes.
grapes.
Yes,
Okay.
those ones are sweet, right? So you want to eat those in smaller quantities. But the berries, blueberry, blackberry, strawberry, anything literary berry, cranberry, those are good. You can eat those in higher.
Cherries. Mm-hmm.
Cherries as well. Avocado, or what we call in Cameroon pear,
Pear.
that is
Mm-hmm.
good. Even the American pear too is good. It's not too sweet. So those are great together with green vegetables. You can blend your fruits with green vegetables together and come out with a smoothie that is pretty healthy. And I'll recommend that as well.
Thank
Okay.
you so much.
Good.
Thank you so very much.
Mhm.
Okay. Let's look at the
Sorry,
comment
I have a
section.
question.
Yeah.
Okay.
Okay, our men of God, mummies and papas, can they actually treat diabetes or hypertension or any of these things?
No, well, from a Christian standpoint, like miracles do exist. God do heal people, right?
Mhm.
But God has given us the ability to help ourselves with what He has given us. So there's nothing wrong in praying and taking your medication, and that's what I'll recommend.
So
Okay.
you do both.
Yes.
Don't pray. When I listen, no pray, then no take your medication. You
Right.
guys, you when I listen from a doctor, he said pray and take your meds.
Yes.
Some of you only pray and don't take your meds. You end up with a stroke in the hospital. There was that contribution money to pay
Praying
your
and
medical
taking
bills.
medication has never failed anyone, but I
Better.
know
Thank
praying
you,
without
doctor.
taking medication has definitely failed some people.
Thank you so much, doctor. Okay, I have a question from the comment section on diabetes. Um, Sylvia said, which is the best method of checking blood glucose? Is it FBS testing or RBS testing, and why?
Okay. Is it FBS
Like the
test,
finger
finger
stick?
stick, and then
Mhm.
what?
The red blood, the one you, I think the lab, they draw your
Okay.
blood or.
All right. It's very convenient to stick the fingers. All right. Um, the 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 blood sugar content of the venous blood
Mhm.
and the finger stick one, which is a capillary, it's slightly different. Okay.
Oh, okay.
The one in the venous blood is slightly lower than the capillary one. Just because blood moves from arteries to capillaries to vein, and as it goes through that circle, you extract the glucose as it goes around. But there's not a significant difference in absolute number between the two. The finger stick one is very convenient for
Because
home
anybody
use.
can do it
All right, at home, and it's, you don't need to look for a vein.
and
It's
draw blood.
yeah, you
And
can just prick anywhere in your finger, it'll give it to
just
you. But you have to want to get a very accurate reading. You can get the one here on the vein. Okay, so it's worth noting that the finger stick gives you the instantaneous blood pressure, the blood sugar at the time. But if you want to get a more comprehensive long-term average blood sugar, you need to be able to do a better test like the A1C, which gives you an average of your blood sugar 3 months from the moment you drew the blood and 3 months backwards. So in the last 3 months, what is your average blood sugar? The A1C will give you that number, which is better than taking your reading there and then. But if you're a patient on insulin and you need to dose your insulin based on your blood sugar, you need to take your blood sugar, you know, the number of times recommended by your
so
doctor.
fasting blood sugar is the best, right? You want to take it before you eat.
Um,
Fasting, like
Fasting blood sugar is much more accurate because most often,
you
most
don't
of the
have
day you are
anything.
fasting,
Yeah.
right? So when you eat, your blood sugar is expected to go up, right? So the question I want to ask myself is, if you're fasting, meaning from 2 hours
Before.
beyond a
Mhm.
meal, what is your average blood sugar? If your blood sugar average when you're fasting is high, that means that immediately after eating it will
It's
be
go
higher.
higher.
Right,
Yes.
exactly. So if your insulin or your diabetes medication is working well, then I expected that in the fasted state
Your
your
blood
blood
sugar
sugar should
should
be
be
down.
lower.
Right.
Okay.
So that's why I would tend to do
Okay.
measure
Okay.
blood sugar at a time.
All right. We're gonna take another question. Let's see. Let's
Person
see.
asks how the practice.
Oh, we'll come to that at the end.
Mhm.
Yeah, we'll talk about that. I think fast blood is better glucose. Okay, it's random blood sugar. Anytime respective whether okay. Let's see. No wait. Amazing. Hold on. I'm trying to see which other questions we have. Somebody said, what about the effects of high cholesterol on our hearts?
Okay, that's fine. I think we're going to touch on that
Yeah.
later, but let's just
Yeah, let's
address it
just go
now.
ahead.
So it's one of those less commonly known and very impactful changes in our body that have real life effects. So cholesterol is basically fats in simple terms. So if you eat food that is rich in fats, so like the skin of a chicken has more fat in it.
Mm-hmm.
Some oils, palm oil, unfortunately, has a lot of
I
what
know,
we
and we use
call
it all the time.
saturated fats,
Mm-hmm.
which is not the healthy fat. Olive oil, avocado oil, those are healthier oil. They have unsaturated fats, which tend to be healthy in terms of for the body. So once you eat foods that are rich in fats, most often very oily foods, fried foods, um, I would say pork or beef that has a lot of fat chunks in it, those are not very healthy to eat because those fats, when they get into the bloodstream, over time, they can deposit themselves on the blood vessel wall if the concentration of the fats in circulation is high. Some of them will deposit themselves on the blood vessel wall and progressively cause obstruction. Now, when you have high blood pressure, uh, blood normally flows in the blood vessels and the lining of the blood vessel is smooth. But over time, that lining becomes less smooth, right? And if you have a high amount of cholesterol or fats in circulation, the uneven interior of the blood vessels serve as a catalyst for those fats to deposit, right? If this happens to blood vessels leading to the heart, and they would progressively obstruct blood flow to the heart and can lead to heart attacks in the long run. Okay, so cholesterol, high blood pressure, they go hand in
Hand in
hand
hand.
to cause
Heart
stroke. So
issues.
those are risk factors. Now, um, the deposition of fats in the blood vessels is a silent phenomenon. You don't have any symptoms
You don't even
typically.
know what's going on.
Exactly. But you can pick it up when you do a blood test. And it's very important to know that that's one reason why when you go for your annual physical, they ask you to come fasting,
Fasting, yeah.
right? If you eat a fatty meal, within 9 hours of drawing your blood, then it may give you a falsely high average cholesterol level. So they may falsely diagnose you high cholesterol, meanwhile you don't have it. So it's very important to have preferably a meal that is mostly vegetable based, in a few days leading up to your
Before.
blood test. But more importantly, to eat this meal, 9 to 12 hours. You know, you should fast for at least 9 to 12 hours before your cholesterol test. It's very important to drink water the morning of your test so you're hydrated overall. If your cholesterol level is high, then your doctor needs to come up with measures for you to decrease them. Most commonly, decrease fatty food intake and exercise. Okay, but if you have high blood pressure, you have diabetes, and then you have a certain number in your cholesterol reading, then in addition to those general measures, you need medication to lower your
Lower.
cholesterol. Okay.
And the test to check for your cholesterol is a lipid panel.
Yeah, it's a lipid panel,
okay.
lipid profile, but it has to be a fasting lipid,
Lipid
panel.
panel.
That's
Okay.
very important.
Okay.
Yeah, go ahead, read the question.
Why you want married? You know the one they talk why you
Doc,
laugh.
they seem advising me
Doctor,
the cocoa.
I have somebody here.
Right. Go ahead.
She said, Doctor, please advise Ewube Brown to eat olive oil. The girl eats only palm oil. Advise her a bake. I'm the one who cooks with olive oil in my family.
All right. Ube Brown, I've been delegated to advise you that you should eat olive oil rich foods. Okay.
Olive oil is for rich people. It's
Yes.
expensive.
That to be realistic, that's very true. If you decrease the amount of canola oil, vegetable oil that you use, and use olive oil sometimes, then you mitigate the risk. Okay. I have to be realistic. Fruits and vegetables are more expensive than some of the McDonald's. Okay. But that's not to mean that I would not eat healthy because everything is expensive. It comes down to choices we make in our life, right? Some persons cannot pay their rents, but they can buy red bottom shoes. So it all has to.
It
You
really
have to
does come down to.
yeah. So you have to be realistic with yourself and make healthy choices for what to you is the best investment.
Okay,
Mhm.
okay. Somebody says, what is a normal A1C?
Okay, for an adult, the normal A1C has to be less than 5.7%.
Less than 5.7.
Mhm.
Okay,
5.7% or less. Let me say
okay,
less than 5.7. From 5.7 to 6.4, that is pre-diabetes. Okay,
okay.
6.5 and above is diabetic. It's worth noting that it's good to have at least more than one measurement. Ideally over like a few weeks to give you an average number, because it can be confusing if you take a patient's A1C today is 5.8, then 2 weeks, 3 weeks later is 5.6. Then you don't have
You don't have a
a good conclusion.
good
But so
conclusion.
one measurement typically is
It
not, it doesn't
is
give you
not
the
good. So
answer.
like 2 or 3 measurements, so you can compare. You can have
Correct,
a
and get an
comparison.
average, right?
Okay.
But typically, there's not a big change in my opinion. So some people have tried to manipulate it. Um, they'll do things like, okay, I'll fast for a few days, I'll drink a lot of water to try to dilute the number.
Before they come.
It's worked for some instances. I say this because life insurance company are very critical about that. All right.
Because they check everything
Yes.
when they ask for your medical records, correct?
Correct.
Okay.
And at times they'll send their agents to come to you and
Oh,
draw
that's true.
labs, right? And an A1C of 5.8 and an A1C of 5.6 can make a huge difference in what you pay as life insurance premium. So it's very critical. That's why you need to act on it if you really want to get the best health insurance policy. Okay. I would say take time, work on it. That's just one parameter anyway, but it does count a
Okay.
lot. All right.
All right. We have another question.
Mhm,
Then we move to something else.
mhm.
We'll take one more question. Can he describe the cutoff for high blood sugar?
Okay. So high blood sugar, that's the fasting
Blood
blood
sugar.
sugar, right?
Yes.
She has to be 126 or less to say you're not
126 or
you're
less.
not diabetic, right?
Okay.
Between 110 and 126, you can say you have elevated blood sugar or impaired fasting glucose. So to be on the
Safe side.
side, you want to have it under 110. Some people says 100. It just depends on the lab. The lab would typically, depending on the method they use, they would define that. But if you have across all methods, if you have a fasting blood sugar that is under 100, you're good to go.
Okay.
All right.
All right.
Mhm.
Hope that answered your question.
But not less than 62.
Not less than 62, then you're going
Well, I would say
low.
66. Yeah, because
Okay.
then now you be hypoglycemic.
You become hypoglycemic. Okay. Okay, I know. I wanted to ask this too. And Dean, I'm glad you brought this up. I know we've talked about hypertension, but there's a lot of issue with this. Okay, somebody said, Doctor, we've already done, but I'll bring it to because I wanted to talk about it.
Right.
Doctor, patients with high blood pressure should reduce sodium intake. How about Maggi or chicken bouillon? You know the thing we use to spice because I always wanted to know, like, what can we substitute it with? Because everybody's like, oh, that Maggi is full of sodium. But our African food, we need it tasty.
We have many African spices, right? If you
Yeah.
take Maggi out of your repertoire of spices, trust me, you can come up with other things. We have a lot of spices in the African community that we can mix and match. I will not miss Maggi.
But we
Um,
can, okay, so we don't do salt. Now they say Maggi
I,
because
I,
of the glumate or sodium, whatever it has.
to be honest, I don't know much about the controversy surrounding Maggi,
Mhm.
but what I would say is that you have to eat some sodium. Your body needs it,
Okay.
okay?
You cannot totally eliminate
Right,
sodium.
exactly.
Okay.
You need at least 1,500 milligrams a day from all sources of sodium. The key is to try to reduce your intake. It's difficult to really tell in practice how you do that, but I would say if you can taste Maggi in food, you probably put
Put too
too much.
much.
Right.
Yeah.
It's just enough not to feel it in the food. For some people, it will not make their food taste healthy. But with time, your taste buds get used to having a lower concentration of sodium or sodium chloride in it. It doesn't matter if it's sea salt or pink Himalaya salt. No, all of them is salt. You gotta reduce them. Okay.
All right.
Mhm.
Thank you so much.
Mhm.
So another thing I'm gonna want you to touch on is cancer. You know, when we were growing up,
Mhm.
Cancer was, we used to say cancer is for rich people. Because when I was little, you don't know too many people that have, cancer was like the people that have money that live rich, they will get cancer. But like, oh, not rich people sick. That's how we used to call it when I was little. We used to refer to it like rich people sick. But now,
Mhm.
ah, every cancer is like hypertension. It's common now. What happened to this man? Oh, they diagnosed them of cancer. What happened to this man? Oh, they had cancer. So can we talk about like the common types of cancer, the warning signs, and some preventative measures?
Okay, good. So cancer, in a way, is what noting that cancer is not one disease. Cancer can affect multiple organs. One type of cancer can have different presentation and manifestation. So the treatments, they differ depending on the type of cancer. Okay, so it's not one disease, and the disease mechanisms differ from cancer to cancer. That's why it's been so difficult for science to come up with what you call a cure for
Cure.
cancer.
Mhm.
Yeah, you can come up with a cure for one cancer, but another one will elude you for, you know, for a long time. So keep in mind, cancer is not one disease; it's a whole constellation of diseases that have a common disease process. Okay, when we're young in developing countries, growing up in developing countries, cancer was rare because most cancers tend to come with advanced age.
Age, yes.
In developing countries, most people die before they reach advanced ages,
So
50,
we
60
didn't get
years
it.
ago.
Hmm.
Yeah, so we died more from infectious diseases. We didn't live long enough to develop cancer in most cases. All right. But nowadays, with better lifestyle, we're living older, we're living into ripe old age, and therefore it seems as if cancer is resurgent or the incidence is increasing. All right. Um, the common types of cancers are equally related to lifestyle. Okay. So, in women, it's breast cancer, it's colon
Yeah.
cancer. You have cervical cancer too, that is very common. In men, it's prostate, it's lung cancer. Those are the two leading forms of cancer in men. Okay, and colon cancer as well. I'm not let that go. So for breast cancer in women, the causes are most are multifactorial as well. You have family history, that's important. So if you have some genes in your family that run in your family, BRCA1, BRCA2, that will increase your risk for breast cancer. If you're a woman that had your menses
Later age.
at a very young age,
Okay.
and then you had a delayed menopause, you had longer reproductive lifespan, and therefore you were exposed to the female hormones for a longer period of time. That can raise your risk. Obesity can raise your risk. Overall poor
Health.
health, lack of physical activity, range of other things that's similar to obesity and um and um and um and diabetes. You know, those will increase your risk overall for all cancers. All right. If you smoke, that really increases your risk too, and exposure to some female exogenous female hormone products.
What
Okay.
about chemicals?
Yeah, well, that one is kind of controversial.
Okay.
It, I don't remember any chemical that directly will cause that, but radiation exposure can lead to cancer too. If you have X-ray treatment of one part of your body close to a breast, that can secondly lead to breast cancer. Okay. For smoking, it's a big risk factor for lung
Lung cancer.
cancer. Irritates your lung. Chronic exposure to smoke is very critical.
What about secondhand smoking? Can you?
Secondhand smoking, absolutely. So any form of smoke that is inhaled and goes into the lung, irritates the lung, can cause changes at the cellular level and lead to lung cancer in the long run. So that's why it's very critical to quit smoking if you smoke, if you want to avoid lung cancer. And um, the other cancer, which I must mention, is colon cancer. The colon is a big, is the big intestines, to be very precise, or to make it simple to understand. It's a tube with a large diameter. So for you to develop cancer and have symptoms, that cancer would have been there for long. It's worth noting that cancer, I should have defined this, is an abnormal growth in a body's path. Okay. Cells just keep multiplying, multiplying. They don't have any control. Normally, the body checks the way cells multiply and limit their growth. But for some reason, cancerous cells lose the stimulus or the
Is it
stimuli.
because the body don't recognize those cells and they can control them?
Good. So the body has immune cells that can check the growth of cells and limit their size and their growth. But in some instances, those cells lose the ability to check the growth of those cells. Those cells now convert themselves into cancer. In a very simplistic way, that's what happens. So the best way to mitigate cancer illness or death from cancer is to screen at regular intervals. Screen people you think are at high risk, right? Good. So for women over the age of 40,
That's where you do your mammogram.
correct. So
Yearly. When I listen, yearly mammogram, because I know some people, they have never done mammogram and they're like 45 years old. Mammogram and pap smear too, correct?
correct, for cervical cancer.
Yeah.
So it's kind of controversial. Some bodies say do mammogram every 2 years. Some say every year.
Every year, yeah.
So at minimum, every 2 years, mammogram is a specific kind of X-ray of the breast. You pick up abnormal cells, abnormal masses that the woman cannot feel with her hand, and those often are harbingers of an abnormal growth. If they do see an abnormal growth, then that mass or that area of the breast needs to come out, or the whole breast needs to come out, or the patient may need chemotherapy before surgery. The beauty about breast cancer treatment in that most cases are treatable, and most women would typically survive the breast cancer.
And is that
if
why
it's not spread to other
So-
parts of the body.
and is that why, because I know breast cancer is one thing that they always say prevention is better than cure.
Mhm.
Because if you do your yearly mammogram, correct, and they see something, they can fix it before it gets worse.
Absolutely.
Okay.
Yeah, so that's the main rationale or
Okay.
reasoning behind screening tests, to pick the disease up at an early stage before it becomes, it spreads to other part of the body. Right.
Okay.
Yeah.
What about prostate cancer for men? Because a lot of men are scared to take the test. I don't
Alright.
know.
Let-
They're
let's-
like, oh, I don't want to go do
let's-
that test. The doctor is going to put the finger in my whatever the way they do the test. I don't know.
All right.
But a lot of men like and they at age where they can go do the prostate exam, but they don't want to do it.
Okay.
Tell them.
Let me let's finish with women, that will come to men.
Okay,
That
correct.
way don't mix things up. So for cervical cancer in women, the pap smear is very critical. The most common cause of cervical cancer in women, or cancer of the cervix, is an infection. Is the most common sexually transmitted infection, which is the human papilloma virus.
HPV.
HPV,
Okay,
right.
HPV.
So to prevent that disease, there's a good vaccine now that will give to kids as young as
So
age
is
9.
would you recommend that?
All right, because it's been around for a while. They've conducted studies and it's been shown to be safe. It prevents against the most common strains of the virus that have been shown to lead to cervical cancer and at times warts, genital warts. Okay, some of those vaccines, the vaccine will prevent some genital warts and cancer as well. So even with the vaccine, no vaccine is 100% efficient or effective. So you still have to screen. All right. Rare causes of cervical cancer are not related to HPV. So those are some of the reasons why you still have to do a pap smear. It's recommended to start doing at age 21, for women that are sexually active, and the intervals vary. Typically, it's a minimum of 3 years. If you're above 30, it can go up to 5 years. But you can pick up cancer at early stages and then treat them too. Okay. Colon cancer, the most common screening modality is a stool test.
Mm-hmm.
You look for blood in stool, or you do a colonoscopy, in which they put you to sleep and go in through your anus with a camera and look all around your colon to see if there are abnormal cells. That is better than doing a stool test. If you do a stool test and you have blood in it, you still have to go and do
Go
the
and do the colon.
colonoscopy. Okay.
Okay.
But insurance tends to pay for the cheaper option, which is the stool test
Mm-hmm.
or a DNA test in stool. Okay. Whichever one you can afford, I would say go for it. If you can afford the colonoscopy, that's the
Then
preferred modality. Uh, it's just better, that's what I would say. Now, if we switch over to men, prostate cancer is pretty common, but it's a very slow growing cancer and it tends to occur in men over the age of 50. Most men with prostate cancer would die of other things and not of the prostate
oh,
cancer.
okay.
But if you do develop prostate cancer as a man, that's a 100% occurrence to you. So there's still value in screening men for prostate cancer, particularly if you have a first degree relative, that's your brother or your father or your son who's had prostate cancer. It's very important to get screened. Okay. Um, yes, doing a digital rectal exam is one method to tell if there's an irregularity within
The prostate.
prostate, but there's a blood test that you can do
Oh, okay.
that the PSA, prostate specific antigen,
Yes.
it tends to be elevated in men with prostate cancer. So, but other things can cause that PSA to be elevated. So, seeing a high PSA does not mean you have cancer. It just means there's a high chance you have it, in which case you need to do an ultrasound of the prostate and look to see if there's some abnormal zone that you can biopsy and check for cancer. There are good treatments too for prostate cancer. Okay. But smoking for lung cancer, so men or women who have smoked for many years and are over the age of 50 to 55, we recommend that they do an annual low dose CT scan of your chest to check for lung cancer. Because lung cancer is one of those cancers that can be there for many years before you pick it up. And by the time you pick it up, it may be late. So that's why you have to screen for people that are at high risk. Okay. But the more important thing is to quit smoking.
Okay.
Right.
What about alcohol and the liver and the pancreas?
Okay. Now this is where I'm gonna lose some of my friends. But
Me too. I'm gonna lose some of my friends because I brought this up. Because I tell them every time as you did drink that alcohol, so yeah, your liver, your pancreas, they cry.
So alcohol is one of those very common social drugs.
Yeah.
Just like caffeine or coffee. It's recommended that the adult man takes no more than 2 drinks a day. And a drink is a typical size of a Heineken, okay? 11 ounces of beer or about 5 ounces of wine, or 1/10, the volume of a Heineken for stronger spirit.
So it's recommended too?
No more than 2. No more than 2 for men. No
Do you
more
know
than,
how many
no more
this
than
my
1.
people drink?
No more than no more than 2 a day for men, not more than 1 for a woman. Okay. The reason is because there are genetic differences in the way we metabolize or process alcohol. Okay. So the overall message is you're gonna limit your alcohol intake, because not only can it affect your liver if you consume large amounts, it can cause it can raise your blood pressure, and it can cause vitamin deficiencies like B12. You drink a lot, you don't absorb vitamin B12 as well. Chronic alcohol use or dependence can lead to mental health problems, alcohol related dementia.
Mm-hmm.
It causes a lot of social problems too. Once you
It
drink,
makes some people angry. They drink, they go down, they beat their wives. Yeah, it brings,
Yes.
it triggers people to do some stuff they're not supposed
Correct.
to do when they're not under
Correct.
the influence.
Correct. That said, a bottle of red wine every now and then can actually lower your cholesterol or raise your level of good cholesterol. So all is not bad about alcohol. It has some positives, but the key thing is moderation if you must drink.
Drink
Okay?
in moderation if you
Correct.
must drink.
Yes, and preserve your liver.
Mm-hmm.
Yes.
Okay, what if we don't drink daily but consume heavily over the weekends?
No, you can't do that.
It
That is
adds
called
up,
binge.
isn't it?
That's binge drinking. All right.
That's bench drinking. It's even worse than
Yeah,
daily.
exactly. So you get drunk when you do that, and once you're drunk, there are other accidents that can occur.
Yeah.
Okay, you can have what they call acute alcohol intoxication.
Hmm.
Yeah, it can affect your heart, and not only raise your blood pressure and cause you mental, disorientation. Um, it's probably better to drink in moderation and drink more days than to drink, a 12 pack on a weekend.
So the goal is to drink in moderation. Don't exaggerate it.
Mhm.
Because I know people that drink every day, then the weekend, they quadruple their quantity. They feel like then when you tell them about your pancreas or your liver, they say something will kill a man. Like,
Absolutely. There's always justification for any bad behavior,
yes,
but sooner than later, it's going to catch up with you in life. So
exactly.
everything in life should be done in moderation.
Everything
Yeah.
in life should be done in moderation.
Hmm.
Moderation. Let's see. Okay. Let's see if we can get one or two questions before we move to something else. Somebody said, let the doctor elaborate on the importance of good ADL, that is good cholesterol, and bad cholesterol.
Okay. All right. I mean, I can touch on that a little bit. The key is to know that, decreasing your fat intake, exercising, eating healthy,
Mhm.
that would automatically lower your bad cholesterol and raise your good
Good cholesterol.
cholesterol. Okay. So the good cholesterol tends to help mop out of the body the bad cholesterol. And the bad cholesterol, higher in number, tends to block the blood vessels more. So LDL is the bad cholesterol.
Okay.
That's the one that will commonly deposit itself or lead to deposition of fats in the blood vessels and lead to heart attack. Like I said, HDL is the good
Good
cholesterol
cholesterol. And that's the one you want to.
to elevate. And
Okay.
exercise is very key in raising the good cholesterol. Okay.
Mhm.
That's why exercise is very important.
How are we doing on time?
We're both done.
We're above time. All right. We're above time, but can we just touch one thing before we go? Then I'll give the doctor an opportunity to tell us where he works and where he practices. So
Okay.
people that need, if you need his services, let's talk just a little bit about preventative health
Okay.
in general, especially for people in Cameroon.
All right. So preventive health, like we've touched some aspects of it,
Mm-hmm.
is stopping the disease in its tracks before it develops in the first instance. The most popular way to prevent disease is vaccination. Okay,
Okay.
most countries have vaccination programs. It doesn't matter where you are, whether in Cameroon, in the U.S. We get to vaccinate our kids for common infectious diseases like measles, mumps, rubella,
Malaria.
hepatitis B, and so on.
Mhm.
Even Cameroon now, malaria, of course. There's a new vaccine that is available. Please make yourself avail yourselves of that and help your kids. It will help decrease the more serious forms of falciparum, which is falciparum malaria. Now, for adults, particularly here in the United States, um, most people tend to think that I got all my vaccines when I was young. That's not the case. You still need vaccines. We have, of course, the flu vaccine that is recommended to take during the flu season. Some people don't believe in it.
I was just going to ask you to, can you tell us a little bit? Because there's some people that are against vaccine.
Okay.
Like they say vaccine is causing, like they totally, you can't tell them nothing when it comes to vaccination. They don't want your kids to have it. They don't take it. What can you say about that?
Well, vaccines before they are released for circulation or for use in humans, they have been tried in animals. They have been tried in human volunteers. They've been found to be safe and to actually prevent diseases. Okay, just like everything else in life, even if there's a medication that has been shown to be effective, there's still going to be a segment of the population that will still not take the medication, and it's their right to refuse treatment. You have to respect that too. Okay, because some medications do have side effects. Vaccines, some people are allergic to them. Some vaccines are not 100, most vaccines are not
100%
100%
safe.
effective.
Okay.
So you can never guarantee them that giving you this vaccine will prevent you from having the disease. So they still have a point. That not that said, vaccines are still important tools to fight diseases. Um, in most infectious diseases, you don't need to vaccinate 100% of the population to prevent the disease. You need to vaccinate a high enough percentage of the population to prevent everyone else from having it. I'll give you a simple example. If you have a house of 5 people, 4 people are vaccinated, that house is considered vaccinated because even if the one unvaccinated person contracts the infection, he will not be able to pass it on
To the other people.
because in most cases, because they're already immune to it. Um, but what is the chance of just that one person being vaccinated? It's very low, all right? Because 4 other people,
I've already been vaccinated.
correct. So for that one person to be infected, they need to go and interact with other unvaccinated people who have the infection somewhere else. So that's to decrease the chance. For adults in the United States, it's very key to take your tetanus shot every 10 years. You may prick your hand cleaning your garden or somewhere and develop tetanus. Tetanus is a rapidly fatal disease. That's why vaccination is important. For adults who are smokers, who have asthma, it's very important to take the pneumococcal vaccine that can cause pneumonia.
Mhm.
For adults over the age of 65, it's good to take the pneumococcal vaccine, whether you're a smoker, you have asthma or not. It's still recommended because as you grow older, your immunity wanes.
Great.
Okay, and shingles vaccine too is good for those
Okay.
people. One other one which I tend to forget, or which most doctors tend to forget to mention to their patients, is the hepatitis B vaccine.
Okay, Hep B.
Yes, it only became available for circulation or for immunization for kids, I think, less
And for
than
healthcare people,
less than
healthcare
20
is
years ago.
mandatory when you're in the healthcare to take the Hep.
Correct.
You
But,
are,
but
yeah,
come to think of it, most adults in the US and in Cameroon, they don't work in healthcare.
yeah.
Yes, but hepatitis B infection can lead to liver cancer, can lead to fulminant liver failure,
Hepatitis.
hepatitis B. So
Okay.
please have your doctor check you whether you're immune for against hepatitis B or not, because some people develop immunity from the infection. They may not even know about it. Those people don't need the vaccine necessarily. But if you are not immune and you've never received the vaccine, please go get the vaccine. Most uh, county departments of health
Yeah,
do
they
have
will have it.
vaccination centers
Yeah,
where you
and they
can
give
go
it for free, cheaper.
right.
Especially those preventive vaccines, they'll give it for free.
Correct. So that is that for prevention. For sexually transmitted diseases, of course, you got to practice safe sex.
Use condom.
Use condoms. Use the dental dam. Most people don't know what that is.
What is that? I'm just
Um,
hearing this for the first time.
Oh, really?
Yeah.
It's a condom. It's like a condom. It's a piece of plastic too, but you use it to cover the vaginal area.
Oh, you mean like the
Yeah.
female condom?
Yeah, it's like a female condom, but it's more flat. It's like a square sheet.
So that one is for the girl.
Yeah, it's
Okay,
for
it's for the
oral sex
female.
for the female.
Oh, for oral sex.
Yeah, it's
You
you protect the vaginal area. All right.
That so
Because they're sexually transmitted diseases that they can be
Like,
transmitted by direct contact. Okay.
herpes.
Anything that that is sexually transmitted disease, direct mouth to genital contact can
Oh.
transmit that.
Ah.
But when you use
That
a
one go hard
barrier
though.
method,
It go hard
you
though.
can use it. It's actually
When you
pretty
in
common.
action, do you think about taking that thing and put it there?
Well, if you worry about transmission, you think about it. Okay, dental, like a dental, and then dam, like DAM. Okay, that's what it's
No,
less
I'm gonna
talked
worry you.
about, but it's very critical because there are a lot of women and
Mhm.
men too that come into the clinic with sore throat, and the thing
Ah.
is strep throat,
And they get it from
but it's
licking.
actually chlamydia, gonorrhea. Okay, so be very careful. Consider that,
Well,
please.
we're talking a sexual sexual side first before we even talk about other things. Not time, not even there for going into more details.
Use contraception. It's very important, please.
Okay.
Yeah, 50% of pregnancies are on plan,
Unplanned.
right?
Okay.
If you want to have a less stressful life and relationship, please
Mhm.
plan your pregnancies. It helps a lot.
Okay.
Mm.
One thing I want to talk, Torida, I know we don't have enough time, but please, this is also important. Then we're going to conclude. Please. Okay. For high blood pressure medications, right?
Mm-hmm.
For men,
Mm-hmm.
because when we look at it now, a lot of our guys having like heart failure, strokes, and heart disease is because they stopped taking their blood pressure medicine,
Right.
right? And sometimes when you ask people, why were you not taking your blood pressure medicine, they say because it causes sexual side effects,
Right.
like they have erectile dysfunction, they can't be with your woman and satisfy them. So how can you educate our people when it comes to taking your meds and the side effects and some of the obvious?
Okay. So it's true that some blood pressure medicines have sexual side effects, but most sexual dysfunction, erectile and co, they have multiple causes, not just one cause. I need to stress that overall poor health in men, low testosterone levels, diabetes, those who cause erectile dysfunction, irrespective of what kind of blood pressure medicine you take or any medication you take. Most often, once those other causes are addressed, including obesity, sexual function picks up. All right. That said, a class of drugs, notably beta blockers, and they will cause they may contribute towards erectile dysfunction. There are many different classes of blood pressure medication that a patient can use if the beta blocker is causing a major side effect. So talk to your doctor, have them switch your drugs out so that you're compliant.
Okay.
Okay. Most often, sometimes a doctor may run out of options because the patient is already on 3 blood pressure medications and the blood pressure is not being controlled.
Mhm.
In which case, now the patient may need to make a choice between his sexual health, his heart health, and his brain health. You know,
Which
so
one? Which one? Which one? You weigh your options. Weigh your
right, you got
options.
to weigh your options. Even in those cases, you can still give them performance enhancement agents
Like
that
Viagra.
that will help. Right,
The
that
Viagra
can.
is causing heart attack. People dying from that thing.
So it depends too on the dose. It depends on a lot of
Oh, maybe they take
factors.
too much. Maybe they take it, then they drink alcohol.
Yes, those
They
additive
want to
additive.
function fast. They're like, give me two, not
So
one.
it depends. It depends. Each case is individualistic. You have to individualize the approach in managing those patients. Okay, and I would equally say for most men, particularly those who are overweight and obese, one reason why you may have a tough time losing weight is because your testosterone levels are low.
Oh,
So generally, from the age of 40 onwards, testosterone levels start dropping in men. It makes them have less energy. So if you're struggling to lose weight and you're having a tough time, please have your testosterone levels checked.
okay.
Okay.
All right. Thank you so much, Doctor. This was really very educative and very informative. So now we have people asking
Mhm.
about your practice. Where do you practice? If somebody wants to come to you for checkup, tell them what you. I mean, we all know you're a medical doctor. Tell them what you practice and how
Okay.
they can reach you.
All right. I work in the DMV area. I work in Duncanville, it's south of Dallas. My practice is at Everett Psychiatry and Family Medicine. We are at 102 East Daniel Dale Road in Duncanville. We have a combined psychiatric and
Medical
general
practice.
medicine and practice. You're welcome to come in at any time. Give us a call. Our phone number is 469 868 6250. We do accept walk ins. I'll prefer appointments.
Appointments. Yeah.
We do accept patients without insurance. We do patients across the lifespan from kids
To
to
geriatric.
correct. Yes. We have we're pretty prompt with scheduling appointments. We'll give you the best of care. What we can address in our clinic, we have a network of providers we can refer you to. We do weight loss, weight management. we do
Weight loss. If you need help,
we do
if you need
do
help,
we do equally do functional medicine. We'll give people shots, B12 shots. We'll give them IV infusions to boost their energy levels. We have a whole range of products that we can help service patients with different needs. All right.
and if you need more information, you contact me. I can direct you.
Right. One other thing, which, if you don't mind me just adding,
Go ahead.
it's sleep.
Sleep. Oh,
Sleep is very
oh,
important.
oh. Tell us, because insomnia is dealing with me, man.
So, of course, stress will make it difficult for you to fall asleep, worry about our finances, worry about our children, our job, all of that. There are stresses in life that can keep us awake at night. But for us to function efficiently, the average adult will need, you know, 7 to 8 hours of
Okay.
sleep. Kids need more. Um, but the key thing is just not the number of hours of sleep. It needs to be at least continuous for 6 hours. The restorative sleep is one that is continuous, minimum of 6 hours, so you can develop what we call a rapid eye movement sleep, which is the
REM.
restorative sleep. All right. Um, if you find it difficult falling asleep at night, you need to tone down every stimulus or stimuli that will keep you awake at night. By this, I mean, take
Phones, tablets, technology,
exactly.
internet.
Simply
Okay.
because the light from those devices, once they hit your eyes, they make them difficult for you to fall asleep. You need to bring down the temperature in the room so it's a little bit cooler, so you
Mhm.
can stay under your blanket and easily fall asleep. And so it's very important to keep a consistent sleep pattern. Young people tend to abuse their sleep a lot, and they don't follow a consistent sleep pattern. Avoid taking stimulants before you go to bed. By this, I mean coffee and alcohol. Those will mess up your sleep pattern as well.
So what about people that say they have to drink alcohol helps them sleep? Like it helps. They have to take something before they can sleep.
That's an impression, honestly. So it depends on the dose. At certain level, alcohol
Can help
is
because it's
disinhibition.
true.
At a
What you
certain
just said
level,
is very true.
right.
Because sometimes if I take a little quantity amount of wine,
Mm.
it puts me to sleep. But if I drink past a certain
Right,
quantity, I can't sleep at all.
right. So since it's very difficult to tell that
Yeah, that
quantity,
thin line, like how
yeah,
much do you need
just make sure
specifically?
you drink far away from your sleep hours. That's what I would say. So
Okay,
you have enough time to metabolize it, okay? Because your sleep is very important for your brains to function.
function.
Particularly students that need the sleep to form their memories, such that to consolidate your memories when you're sleeping. That's the best thing. I'll be honest. I used to abuse my sleep very much when I was a younger person. I'll fall asleep in, in a lot of places. But when I started observing my sleep hours and sleeping more, most of that went away. And exercising regularly too will help restore your sleep pattern.
So, do you think to get a sleep study is good when you're having sleep issues? Is affecting your blood pressure? You're not you
Uh,
having.
I'm glad you brought that up. Almost forgot that. That
Yeah,
is very,
please.
very important.
Okay,
So,
thank you.
um, sleep study is typically ordered when we suspect that a patient has sleep apnea.
Yes,
The common presentation of sleep apnea is an
snoring.
obese
Okay.
male or female that snores frequently when they sleep. So that is very important because it can break up marriages. One partner snoring
Yeah, you
and the
can't
other
sleep.
partner cannot sleep. It's a
Yeah.
big issue, and it should be treated with a lot of sensitivity because most people who snore, they don't choose to snore,
Hmm.
you know.
They don't even know they're snoring.
Absolutely, because it's very difficult because you're unconscious when you're sleeping, right?
Hmm.
So snoring can lead to high blood pressure,
Hmm.
and that can secondly affect the heart because it can cause the heart to go into arrhythmias. So it's very, very critical if your partner is smoking, is snoring, and tend to fall asleep during the day or fall asleep watching TV. Those are indirect signs that they may have sleep apnea that needs to be addressed. Okay. So a sleep study will help establish that diagnosis. That individual may need to use a CPAP machine, may need to lose weight to be able to control the
This.
symptoms.
Hmm.
It is very important because you help prevent a difficult to control blood pressure and protect your heart. Okay. But losing weight is
Because
key.
I've noticed most obese people have sleep apnea.
The reason is because once you are obese, you have a little bit of fat
In
in
your
most parts of your body. In this instance, there's a lot of fat deposition in your throat. Okay. Once you sleep at night, you breathe in air, it goes through your throat into your lungs. Okay. Because the mouth and the nostrils, they have a junction at the back of the mouth where they kind of cross over. So in obese patients or in patients with sleep apnea or who do snore, once they sleep and fall asleep at night, their tongue falls to the back of their throat
yeah,
and makes breathing difficult.
difficult.
All right. But once you lose weight, you lose some of that fat. So if your partner is snoring at night, or tend to have what we call interrupted respiration. So at night they sleep and at times they
Like
can
some people,
just
they be like,
pause.
yeah, they go,
Yeah, they'll pause and then they breathe a little bit
yeah,
fast, then they wake up. Yes, that can be dangerous. You need to have them go get
sleep
checked. Okay.
study, sleep
Talk to
study.
your doctors.
Okay.
Yeah.
All right. So for sleep, somebody said, when I exercise, I can't sleep. What can I do?
Okay. Then exercise at the beginning of the day if you tend to sleep at night,
Don't
right?
exercise late.
Because the thing is, once you exercise, you release endorphins, you're much more alert, you're much more energetic, right? Some people, when they do that, they tend not to fall asleep easily. If you are one of those, then exercise in the morning or before your work hours. That way, you are awake when you need to be awake. All right. Then um once you anticipate you're going to fall asleep, then you don't exercise.
Okay.
It doesn't happen to everyone, but if that's you, then try to take your exercise routine far away from the
All
sleep
right.
hours.
Thank you so much,
All
Doctor.
right.
And everybody is very appreciative. They say this has been very educative to them. They just appreciate you. They're like, thank you, Doctor. Thank you, Doctor. And I'm so glad you accepted my invitation to come here today. I appreciate all the viewers and all everybody that joined us. Please share, share, share. For the people who didn't watch, they can come back and watch it later. So when you share, it goes to other people that didn't have the opportunity to know we were doing something like this. So,
And let them know we can always, those questions that were not addressed, we can always address them in the form of a write up
yeah,
and share it back through the page. Okay.
thank you
All
so
right.
much. You
Thank you
guys
all for
heard from
hanging in.
professional. Thank you, Tori Day, for giving us this opportunity to come here and educate our people. Thank you so much. Bye,
Thank you very
y'all.
much. Yeah. Take care.